Hello friends, I hope you are all keeping safe in this COVID pandemic. I just want to talk to you about COVID infection in children. COVID infection in children can be mostly asymptomatic or mild infection. When I say COVID infection is asymptomatic, I mean the children are not showing any clinical features like fever, cough, etc. But please remember that they are still very much infective. So they should practice hand hygiene, they should cover their faces up with masks and practice social distancing. Otherwise, they are a danger to yourselves or any other susceptible adults like grandparents in their household or vicinity. If they have mild infection, they can still be treated at home. Please make sure that they are not getting worse, so keep an eye on them. The common things to look out for are the fever, which should be controlled by paracetamol, cough, breathlessness, fatigue or tiredness, muscle pain, runny nose, sore throat, diarrhea, loss of sense of taste or smell, among many other things. Paracetamol, as I said, should be able to control the fever. If it doesn't, take help from your doctor. Antibiotics are not routinely indicated. Keep an eye on their fluid intake and also make sure that they are eating soft, non-spicy food. They might not be able to eat very well because of associated pharyngitis or sore throat or irritation within the mouth. There's no indication for any other medications like hydroxychloroquine, remdesivir, ivermectin, Feviflu, or immunomodulators or convalescent plasma to treat any mild infection at this stage. However, do keep an eye on their work of breathing and their saturation because the disease may progress to the next stage in very few number of children. I would give an indication of the respiratory rate which is within the normal range for different age groups in the description. Please have a look there. So what you need to look out for is that work of breathing and the respiratory rate because that indicates that lungs are working hard and they may need some additional support like oxygen from a hospital. Also monitor their oxygen saturation with a pulse oximeter. The oxygen saturation and work of breathing may go even worse if the situation progresses to severe COVID. So it is very important to get them admitted in the hospital and get treatment from your physician at this stage. I now want to make you aware about a special condition which very few children will develop. This is called PIMS or pediatric inflammatory multi-organ syndrome. This occurs 2 to 4 weeks after the COVID infection. Only 0.5%, that is 5 in 1,000 children will develop it. And then again, very few will actually develop it severe enough to get treatment. But what is it? So what happens is, with the infection, the body develops an immune response to fight the virus. And sometimes that immune response is unchecked and fights against the body systems. And so the children can get sicker because there is an unchecked reaction happening within the body. What will be the manifestations? There will be rash, there will be fever, most importantly, that is not controlled, tummy cramps, there can be red eyes, swollen hands and feet, peeling skin, cracked lips, as well as diarrhea and many other features. Now, important thing to remember is, like I said, this can act against any organs in the body and more specifically in the blood vessels against the heart. So it is very important to be aware about it and to get the proper treatment by your doctor at a proper COVID hospital or unit. Finally, I also want to talk to you about long COVID, which is a condition that is affecting many people many weeks after COVID infection. In the children's population, it has been seen that between 2 to 16-year-olds, almost 14% of children are getting affected by long COVID. So what is long COVID? Long COVID is characterized by many features following a viral infection of the coronavirus SARS-CoV-2 many weeks after the infection has cleared. This could be severe fatigue, reduced exercise capacity, breathlessness, palpitation, chest pain, joint pain, fever, inability to concentrate or brain fog, metallic or beta test, skin rash, and they are often associated with anxiety and depression. So it is important for everyone to be aware that such a thing is happening. And number 2, to seek proper medical help according to the need. Number 3 is look after your mental health, do proper exercise. According to the symptoms, get help from your medical professional. I hope this short video will help you. Please stay safe. Thank you for watching.